I now have the delight of welcoming Sue North to talk about PINS and Mary Busk to talk about trauma practice. Thank you.
Thank you, Sarah, and lovely to be here and see everyone today. Lots of people, lovely to see you, not seen in a little while, and nice to see some new faces too. So for people that don't know me, my name is Sue North, and I'm the Deputy Director, one of the Deputy Directors for Children and Young People at NHS England in our national team, and in my portfolio of work, I'm responsible for children and young people who have a learning disability and autistic children and young people, and children and young people who have special educational needs and disability. So I have three colleagues who work for me, who lead on different aspects of our work. Most of them I think you will have known. Lorraine Mulroney leads on our SEND work for NHS England, and she's joining us online, although isn't able to be here in person today. Phil Brayshaw, who I know has spoken before at one of the conferences, leads on our work around children and young people with a learning disability and autism. And Kate Naish leads on our work around health inequalities for children and young people who have learning disabilities, autism and SEND. So I am supposed to be talking about PINS today, and I definitely will talk about PINS, but Mary's also going to just hit me on the back when I'm running out of time, because Mary's also got some really helpful information about some trauma work that happened, and we met with some colleagues from NNPCF to talk about that and decided it would be a good addition to have for the conference. But I guess I also wanted to start by saying there's been a lot of work going on in NHS England that impacts on our children and young people who have special educational needs or disability, learning disability and autism. We know there are some really, really tricky challenges in terms of service provision, support, accessing and navigating services, and we've heard a little bit from the inspections around some of those things that are coming up as well. And there's been big changes in health. I think last year I kind of mentioned briefly, you know, with the Health and Care Act, we kind of moved into ICBs and regional colleagues. And we have some of our NHSE regional colleagues here today, so I'd just like you to stand up, our regional colleagues. Graham, Julie, Dion. Give a little wave. I don't think we've got anybody else. Couldn't see anybody else. Graham over there. And I guess I just wanted to say that because when I say we, I mean everybody in NHS England, because it's not just about what we as a national team do, it's about how our regional colleagues support ICBs, and then how ICBs are working, hopefully in partnership with local authorities and with parent carer forums. So there's been lots of work going on. I think last year I talked a bit more about our key working services for children and young people who had a learning disability and autism who were at risk of admission to hospital. And I think we feel that's one of the most successful programmes of work that we've delivered across NHS England. Had some really lovely feedback actually just this morning from a parent carer that runs a online forum for children who have behaviours that challenge. And she had just written to say, I'm hearing so many good things about the sea change in attitude that the introduction of the key working scheme has brought to so many families. Only yesterday in our digital community, a mother asked if she should agree to her child being put on the dynamic support register and having a key worker assigned to her family. And within minutes, 15 other parents had jumped in and were saying yes, 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 and sharing their own stories of what a difference it's made for their own family. So I just wanted to share that because I think the reason that that programme of work has been so successful is because it was co-produced from the very start. The National Network of Parent Care Forums have been really key and integral to our national steering group, to how that work has rolled out in ICBs. We were really clear and asked for forums to be a kind of a signing member for each area, each ICB area as they began their work. So a big thank you in relation to that. There's lots of other work that's been going on as SEND. We obviously work really closely with our colleagues in the Department for Education and the Department of Health and Social Care in terms of looking at how we deliver the SEND improvement plan. and how we try and address some of those challenges that we know are really significant at the moment for children, young people and families. So I'm going to talk a little bit about PINs, but I know that lots of you do know lots about PINs. And could you just put your hand up if you were able to join our webinar that we ran around PINs a while ago? Okay, so not maybe as many people as I thought. All right, I'm going to talk really quickly then. So PINs is a new project that is being delivered as a partnership between the Department for Education, Department for Health and Social Care, NHS England, and the National Network of Parent Care Forums. And it has just been fabulous having Sarah as a part of our steering group and our work, and Tina has also joined us for some of those sessions. I want to say that the PINs work really evolved from some great work that was led in the North Cumbria and the North East about autism in schools. And that innovative programme of work was about how systems and parent carer forums work together to deliver change in schools that would really impact and improve outcomes for children and young people who had autism. But that it was looking at that whole school approach and looking at how staff could be supported, how the leadership culture in schools could be changed, how parents engaged with schools and how schools engage with parents. And it was a really positive, and it remains a positive programme of work, and had some really good evaluation outcomes. So because of that work, we had the evidence that we needed to be able to put in a bid for the Shared Outcomes Fund with DFE, looking at how we could expand that type of approach. And we're really pleased when the Treasury announced that we had been successful in that bid and that we could roll out this programme of work that is called PINS. And we were debating, just reminding ourselves today what it stood for. What it stands for is Partnership for Inclusion of Neurodiversity in Schools. At the minute, it's a kind of a pilot this year, and it's for primary schools. But because of the amount of money that we've had, it does mean that we've been able to make an offer across the whole of England rather than just in a few areas as we did with autism in schools. So we had to work really quickly and really hard to think about how we would deliver that programme of work, how we could get money out to systems and how that would work to make sure that that partnership approach that we'd seen was so successful and pivotal to autism in schools could be utilised in this programme of work as well. So we have a really different way of how we're delivering this programme, and that is that although the money comes from Treasury to our colleagues in the Department for Education, it doesn't go out to local authorities. Instead, it goes through a very funny route down to us somehow in NHS England, and we give money to ICBs. And that is to enable them to roll out this pilot project, which is using the same types of approaches and models as autism in schools. There are a couple of reasons why we thought that was a really helpful approach to use. One is because I hear a lot, and I hear from our colleagues in SEND, we hear from the inspections, we hear from parent carer forums, that sometimes health are not as visible a partner in that SEND agenda of work. And so we thought this was a real opportunity to really focus ICBs on engaging and working within this programme of work. So what we asked ICBs to do really, really quickly was to come together with their local authorities and their parent carer forums and think about how they might deliver this. And it doesn't cover every school. It only covers 40 schools in each ICB. And I don't know if people are really familiar with ICBs and their footprints across England, but there are 42 ICBs. So in each ICB area, they have between 2 and 10 local authorities that they cover. So clearly, that meant it wasn't going to hit every single local authority, or it was unlikely to. We knew that for some ICBs, it may be that they were working or were only able to deliver it in one local authority, but we knew that some would take a different approach, working with their partners to think what that might look like. So for the last kind of 2 months, trying to remember what month we're in now, we're nearly in March, last 3 months, I think, we've been working really, really hard as soon as we were able to share that information with ICBs, with parent carer forums and with local authorities to try and make sure that as many people as possible were aware of what was going on and that those discussions were happening at that ICB level to think about how this could work, which schools it would work with, how that may run, how that support that would be needed to roll this out could be commissioned. And we know this has been a difficult time of year for ICBs. This is a difficult period for health. We all know that. We're seeing lots of impact still as an outcome of the pandemic. We're seeing lots of challenges because of industrial action that's taking place, lots of challenges about our urgent and emergency care and elective recovery. So we knew it was kind of a bit of an ask, but we were so pleased because nearly every single ICB was really keen to work on this because they recognise that this is a really significant area. We know if we can get the right support for children who have needs at this early stage, it can just change their journey through school. And we know, again, for some of this group of children and young people, that if we can make that a positive experience, if we can make sure that right support is in at the right time, that people understand what might be causing behaviours that may be about environment or maybe about approach or maybe about a whole range of different things that are related to a child's neurodiversity, that can change the trajectory of what will happen for them. So we think this is a really, really positive partnership programme of work. We think it's really essential that parent carers help support the delivery of this, and there is a direct delivery element for forums if they want to do that. And we're really keen. So the slide that Mary is kindly showing you, is the time nearly up? A few more minutes. Okay, I'll keep going. So we're trying to just show on this slide kind of how this all fits together with the broad landscape of things that are happening in this area. Because again, some of the things people say, well, how does it fit with the change programme? How does it fit with the SEN reforms? How does it fit with what else is going on with learning disability and autism and dynamic support registers and CTRs? How does it fit? So we hope that this kind of tries to help show how it fits. Some of you may be in areas where they're rolling out LSEC programmes, which is early support for language and communication. And some of you will be in areas where they've got mental health schools in teams, and some of you will be in areas where autism in school is already rolled out. It doesn't matter. There were no exclusions for being able to be involved in this project. But we did suggest to areas they may want to consider what else is already going on, and if schools are already having some involvement or intervention, it may be helpful to look at other schools. So I hope that's kind of explained really briefly what it is we're trying to do. There's lots more information. There is a webinar that I think you can download or watch online. So that has a lot more detail in it and lots more of the team talking about the detail around that. The really important thing for us is, there's a really tight time scale. So this has to be delivered and completed by next March. So really challenging, and it will have a formal evaluation. But if we can really demonstrate the impact and the effectiveness of this, it puts us in a really good position to think about potential to continue and expand. So there's never any promises anywhere, is there? We don't know what's going to happen in the world in the next year, but we think this is a really great opportunity. We have a small support team. We have a support team that specifically works with our ICBs that's delivered through NHS England. We're obviously working really closely with the network who are helping support with forums, and our colleagues in DFE supporting with local authorities and with schools. So I think I might leave that there. Sarah certainly has lots more information if you want any more information. Julie and Dion down the front here are also actively involved with both autism in schools and PINS, so if you want to talk to anybody, please talk to either of my colleagues here or myself throughout the rest of the day. Thank you very much for having me, and I'm going to hand over to Mary, who's also in our Children and Young People's team. And I will let Mary introduce herself, but I just want to say that Mary will know many of you as well. Some of you may not know Mary, but Mary was part of the national network right from the start. So we were very pleased when she joined us to work in NHS England. She works... Oh, no, I'm going to let you introduce yourself.
No,
I won't introduce...
No, please.
Oh, all right, I'll carry on. Then. Mary is our Senior Family Carer Advisor at NHS England. And so it's invaluable having those roles. We've got 3 family carer advisors in NHS England, and we have some people with lived experience of learning disability and autism that work with our programme. And it's such an important element of our work. And so Mary's going to tell you about some great work that she led on and drove, really, around trauma support for families.
Thank you so much. It's so lovely to be here. And yes, I'm a family carer, one of the founder members of the National Network of Parent Carer Forums. Yes, I have a son who's got a disability, and unfortunately he had to leave our family home and will never return, which is very sad because there wasn't the support for him. So I know something about family trauma. So I think, I know I don't want to keep you from lunch, and this is quite a heavy subject, so I'll try to do my best to make it informative for you. So I think we're certainly very aware of the need for a more trauma-informed approach for children and young people and adults in mental health settings, taking account of their journey and life experiences. And I won't sort of read here, but Baroness Holland's final report, as all of her reports are so brilliant, my heart breaks. She reminds us again about the vital importance of understanding and focusing on trauma and also trauma-informed environments. But throughout all the time I've been in NHS England as a family carer and now a senior family carer advisor, in talking to all families and groups working with families, including your own, it's become very clear, and was always very clear, that many parent carers and family carers are traumatised by their experiences of trying to access services. And some parents may have a formal diagnosis of post-traumatic stress disorder, others do not. So I just wanted to share a little bit about the history of the work. So in wanting family trauma to be better understood and recognised, in 2019 we commissioned some work to help us to try to understand this better in looking at available research evidence, and there isn't actually a lot in the area of family trauma caused by the experiences of working with very difficult systems. You know, what worked for professionals and what would make a difference for families. And as a result, a research article was published by the Tizard Centre at the University of Kent. A video has recently been made by the Tizard Centre, and those will be made available to you, we hope, thanks to Tina and Sarah, so you can follow the links. And also a co-produced training course was developed for commissioners and others working with families to raise awareness of family trauma and how to prevent it. And that training has been delivered through NHS England regions for 3 years. I think one of the key learning points for me when I started on this was we had to remind people. I think there is a wider understanding of trauma in relation to children and young people and ACEs and all of that, but we had to really remind people that we were focused on the trauma experienced by families, by parent carers and by family carers, and that was something that I think was really new to people. So they hadn't really thought about actually family carers, parent carers are traumatised by all that's happening to them. So we also undertook some other work that I've been really proud to have been part of. So the Ask, Listen, Do work, which looked at how systems don't really, in education, health and social care, don't really listen well enough through feedback, concerns, complaints and safeguarding to families, children and young people and adults across education, health and social care. But through that work, we learned a lot, and this is all available on our website, and I commend it to you, resources to help understand this whole area for families. But we learned too that the systems that families find themselves in are many and complex, and we all know that. Services are not always good at listening, and families have to fight for help and to be heard. Families can be seen and labelled as angry and difficult and troublesome, and I am a proud one of those. As a result, they can also be scared to raise concerns and speak up. Within NHS England, we've also commissioned the HOPES model, which is a human rights-based approach to working with people in long-term segregation. And the key working work commissioned for every ICB area to work with children and young people at risk of admission or in an inpatient mental health hospital. That training was really developed in co-production to understand and care for families in the family journey, and many of those key workers have also undertaken the family trauma training. So the training was delivered in 2022-23 and it was a continuation of what we commissioned earlier. And it's a very interactive course, supportive and caring, you know, giving sort of an understanding of what trauma is, how it impacts families based on their own words, and also, you know, how we can improve this together, and also reflecting too on, you know, the fact that professionals themselves will experience vicarious trauma, and they need to be supported as well. So again, this training was delivered through our 7 regions of England to increase awareness of trauma and how it affects the person, the family and the system, you know, recognising it. Some regions opened it to a mixed audience from education, health and social care. Others chose to focus on key workers. So the results overall, we had an evaluation and it was incredibly positive, you know, with 96% of attendees saying it really developed my understanding of what trauma is and why it happens. And it is a lovely interactive course. I've done all of them myself, and, you know, everybody was really supportive and positive in a really kind and caring way. So the next steps are that working with our NHS England regional mental health, learning disability and autism leads, the training will be recommissioned in the next financial year to continue this conversation and understanding of family trauma. And I have to say, our regional leads totally care about and really understand this. So the journey with them, you know, people like, you know, our wonderful colleagues here today from our regions, has been really kind, supportive and understanding. We don't have to, you know, they do understand. So it's really supporting staff to understand vicarious trauma, you know, supporting staff to process and deal with that. We want to roll it out to a much broader audience. We could commission something specific, focusing on multidisciplinary teams, working with children and adults with disabilities across the integrated care system, and also ask for regional representatives and perhaps also a parent carer forum representative to be invited too. So just wanted to thank you for the chance to tell you about this, that we do care and understand family trauma, and we are trying our best to make it better.